Okay, hi everyone. Welcome to 10-minute tutorials. Today I wanted to go over how to practice yoga and also take care of your back. So low back pain is something that I think is most common in our yoga practice, and it's not always the same issue for every person. So the first thing I would suggest if you're someone who experiences back pain is to check with your doctor, get it looked into, making sure that you're getting recommendations and suggestions from them first, and then going to your yoga teacher and always letting them know what's going on. So before I wanted to go over some poses, but I wanted to go over also some things that could be a source of pain. So most commonly, people experience some sort of disc degeneration over time as you get older. Herniated discs are really common, especially in the lumbar spine, so the low back. So with disc herniation, sometimes you can get something called nerve impingement. And nerve impingement is essentially, if you think about the intervertebral discs, so these softer discs in between each vertebrae in the spine, like a jelly donut, and you have root nerves at the back of the spine. When you've over-irritated the inner disc, some of that jelly, which is called the nucleus, can spill out and touch the root nerve, and that's what's causing pain. Oftentimes it's the sciatic nerve, that if you feel pain on one side down the leg, that could be the case. You might be experiencing piriformis syndrome if it's something to do with the sacroiliac joint, and we'll go over all those things. If you are someone who has gone to the doctor and you have an impingement or a herniation in the lumbar spine, and you go to take a yoga class, forward folds might actually cause more harm than they do good, because when you're folding forward, if you remember that jelly donut, the vertebrae are going to be pinching the front side of the jelly donut, and it's going to continue to bring that fluid from the nucleus out into the nerve. So what you want to actually work on more, which might seem counterintuitive, is doing back bends and strengthening the extensor muscles along the spine and back. Also, always working on the stabilizing the abdominal core so we can have more support. So if you're in a yoga class and you know you have disc herniation, you can take a lot of the folds on your back to make sure the spine stays nice and long. And an example of something that you can do is, if you have blocks, rather than taking a standing forward fold, you might just stick with a halfway lift. That way the spine is nice and long and you're not rounding in the spine, causing any damage to that impingement. Cool. So the second thing that I wanted to talk about is twisting in yoga. Twisting can be a really great way to help heal the back, and it can also be a way, if done incorrectly, that you can cause a lot of damage. So it's all about practicing twisting in a way that is sustainable over time. So if you have any known pain in your low back, I would really avoid postures where you're muscling your way through it or leveraging. For example, if I'm doing a seated twist and I sit nice and tall, I bring my right hand behind me, and then I immediately just go place my elbow outside my knee and torque myself over to the right. I'm using my arm strength to go into a deeper range. You can cause a lot of damage to the spine and more pain to the low back. So anytime you do twisting movement, you want to think about slowing down. Think about stabilizing the abdominal core. So what I mean is the transverse abdominis, the obliques, those are your twisting muscles. But when you hug everything in and it stabilizes through the spine, or if you're drawing your navel in, Uddiyana Bandha, or Mula Bandha, lifting up from the pelvic floor, you're finding some length from the spine as well. Then from there, starting to use your muscle strength to find your twist. So just using the core strength to find a supported twist. Then bringing your hand, you'll find a safer twist, a more natural range of motion, and you'll have the supporting muscles supporting this action. And then it becomes beneficial because you're still getting the benefits of working the muscles around the spine, which bring that oxygenated blood back to the tissue and can be really healing, but you're not over wearing away at the vertebrae. So spinal twists are great. Just make sure that you're always stabilizing before you're twisting. So trying not to force things. All right. So my next thing that I wanted to talk about was another common issue of low back pain could be SI joint pain. And your SI joint is your sacroiliac joint, and it's the ilium of the pelvis and the sacrum, which is that flat bone at the bottom of the spine. And when you're standing tall, that locks into place. When you sit down, it completely relaxes all the supporting muscles. So the reason why you might have an SI joint misalignment, meaning your sacrum and pelvis are moving in opposite directions, is because we do things asymmetrical a lot. We're either walking one foot in front of the other. We might play a sport where we just use one hand, such as golf or tennis. You might have a tendency to habitually stand a certain way or sit a lot throughout the day, as many of us do at desks. So if that is the case for you, then you want to really practice poses, thinking about connecting the flat bone of the sacrum in conjunction with the pelvis. So thinking of the sacrum not just a part of the spine, but also the pelvis. So if my pelvis is tilting back, my sacrum's not folding forward, they move together as one. An example of this could be a forward fold. So in forward folds, if you have tight hip flexors, psoas, the muscles that connect to the base of the lumbar spine into the inner groin, it might be hard for you to find a neutral pelvis. It might tuck when you want to sit up straight. And then when you're folding forward, you're moving in opposite directions. So what you want to do is maybe fold a blanket and put it underneath your seat so that you can find that the pelvis is also tilting anteriorly, so forward, as the spine and the sacrum start to move forward as well. So I know it's really subtle and it might be kind of hard to explain, but if you can feel it if you're sitting up on a blanket, or for example, maybe on a block. And if you're sitting at your desk, a good way to find this good healthy S-curve alignment in the spine, if you have tight hip flexors or hamstrings, is to sit at the very edge of your seat with your feet flat on the ground. That helps to find that neutral pelvis. And a neutral pelvis in good postural alignment is that natural S-curve of the spine. So you're thinking about not letting it over tilt forward or back. So when you're standing in good alignment, this is another tip, is just to practice really having a lot of awareness of your posture. And if you are sitting a lot, if you're not aware of your posture, that weakens the stabilizing muscles along the spine and can lead to back pain. So in practicing good posture awareness and leading into my next point, I know this is going a little over 10 minutes, you want to start from the ground up. So think about having your feet parallel. Now if my feet turn out, as most commonly they do for people, they tend to turn out, the cause of this is, and an effect of this, a cause and an effect is a shortened piriformis muscle, which is that muscle that stabilizes the SI joint, which we just talked about, which is connecting the sacrum and ilium. So if you have a tightened piriformis, which is your main external rotator of the hips, your hips are going to have a tendency to turn out. Why this is challenging for back bends is this action actually compresses the low back. So when you're going into back bends later on, you're going to have a lot of pain there in the low back. So what you want to do instead is find parallel feet, even if you have to practice your back bends, whether it's camel or standing back bend or just standing tall with a block between the thighs to find that parallel motion in the legs and the feet, then do so. Another thing while you're standing is to think about drawing the fronts of the thighs backwards in space. At the same time, think about lifting the pubic bone up towards the navel, drawing the tops of the front ribs down towards the pubic bone. So as if there were rubber bands between the hip bones and the rib bones, they're drawing towards each other. And as the tailbone lengthens down, you'll feel the lower ribs on the back slightly lifting up. So you have everything nice and stacked. I might retract my chin slightly if the tendency is to lean the head forward. So the back of the head is in line with the back of the pelvis. And you'll notice a lot of my muscles are working here as I'm standing, and I am developing strong postural muscles through having a habit of awareness of my posture in space. All right, so I know I'm way over my 10-minute tutorial today, but I did want to go over a few other postures now that we've kind of gone over some of the important points when approaching a back bending practice, and if you're someone who has low back pain. So one of the poses is cat-cow. So that's just a great way to first just warm up the spine, find a gentle oscillation in the spine. And it's also a great way to find that neutral point. So a neutral S curve to the spine is that point between cat and cow. So cow pose, we're dropping the belly, we're lifting the tailbone up, broadening across the chest. Cat pose, you're lengthening the tailbone down towards the backs of the knees and rounding through the upper back. So just moving through these with the breath is a great way to safely stretch and strengthen the spine, and also is a good reference point to neutral. Another thing that you can do is practice all the same things that we just did standing and finding that good alignment in plank. So in plank pose, sometimes the tendency is to let the hips slink down, or we overcorrect by hiking them way up. So you want to, again, think about finding that neutral spine, contracting the fronts of the thighs towards the backs of the thighs, lifting pubic bone towards the upper ribs, and lifting the upper back ribs away from the sacrum. So I'm finding length between the ribs and the hips. Good. A few other things, when you're doing belly down core, it's really easy to let the spine sort of disconnect, and also that external rotation of the thighs that we talked about happens a lot. So for example, in Sphinx Pose, see if I can scoot back, your forearms are down and you're tracking your forearms back, reaching the heart forward. Now the tendency here sometimes is to roll to the big toe edge of my feet back here. So I start to feel my hips turning out, my low back compressing. You want to think about making sure that the tops of the shins and thighs and knees are pressing straight down, the soles of the feet are straight up, maybe even press into the pinky toe edge of the feet a little bit. Now here it's easy to sink into flexibility here, let the low ribs just melt towards the ground and move far away from the pelvis. What you want to do to open up more space and support for the low back is to think about lifting the low ribs off the ground into the back and then going a little bit deeper from there. It's the same thing for a cobra. Some of us like to really sink into our flexibility if we have flexible backs, but rather than just passively sinking into the joints, think about knitting the top front ribs down towards the hip bones. Feel all that space opening through the low back, and you're contracting through the abdominal core. So you're stabilizing, protecting the spine, and then bending more from there. Good. Finally, there are other poses you can do to strengthen the back, such as chair pose or bridge pose, where you're lying on your back, lifting the hips. Anything where you're contracting these extensor muscles, so the back side of the back, and lengthening the front side of the body is going to help you to feel more stable in your back bends. So I know this was more of like a 17-minute tutorial today, but there's a lot to unpack when it comes to the back. First and foremost, always talk to your doctor, then talk to your yoga teacher if you have any underlying things, and practice safely, mindfully. And if you have any questions or want to have any clarification about anything, you can always send me a message on my Instagram or email, and I hope everyone has a great day.